I am Colin O'Brien. I'm a transitional year resident, about to finish my first year.
I'm Benjamin Bucher, and I'm a transitional year going into radiology here.
Taylor Schweigert, transitional year resident, first year, PGY1. It kind of depends on which clinical rotation you're on. On our inpatient rotations, UHATs, kind of get in there about 6:30, pre-round, open up the EMR, chart review, look through any overnight events, all that stuff that happens. And then once you got your data, then just go see the patients, kind of formulate your assessment and plans on what's going on.
You get to see a lot of different departments, really get to meet a lot of different residents. So the majority of the time is spent in internal medicine.
You really are completely integrated with internal medicine. It's as if you're an internal medicine resident.
And usually 9 a.m. we rounds for a couple hours on all the patients on the team with your attending, your senior residents, and the interns.
I mean, really the great thing about the transitional year is you get to do a lot of different things.
And then kind of from there on till the rest of the afternoon, if you're not on call, seeing new patients that come in from the ED, those new admissions, kind of going, chart reviewing, working them up, doing a history and physical exam. And then around 4 o'clock, 5 o'clock, kind of signing out to the on-call team. And then if you're on call, stay until 7 and kind of just covering sister teams. And yeah, that's kind of a day in the life of inpatient medicine service. I would say all the attendings here are fantastic. It's a very collegial environment.
If you need help for any reason, the attendings are very friendly. They'll help you. They're very approachable, very knowledgeable.
Yeah, I think that's actually like the biggest strength of Peoria is the people. So our attendings are like the most approachable people in the world.
I know that with medicine there's a very hierarchical structure, but they do a really great job of kind of connecting with you personally first, and then professionally guiding you in your clinical knowledge, being able to kind of instruct you in professionalism and other aspects that you kind of need to be competent in as a first-year physician.
Most of my electives are taken up by radiology electives because I'm going into radiology here. So actually they do something where they start us on radiology a couple months early.
Regardless of where you are, they really kind of treat you like one of your own, and one of their own, I should say. And you're really kind of taken under their wings.
I'd definitely say come interview with us, just experience what we have to offer, and you won't be disappointed.
At JUMP, we do, especially in the beginning of the year during orientation, we go through a lot of different simulations. So for me, I had never run a code before.
At JUMP, there's a lot of different simulations. The ones we're involved in are usually case-based discussions. You do them on your internal medicine, on your ICU, and your emergency medicine rotations, where you'll go through kind of a case, almost like a standardized patient encounter, but with a mannequin.
We kind of, on our onboarding and kind of maintenance throughout the year, undergo clinical simulations on mannequins and then like the JUMP simulation lab, and so lots of good connection and collaboration between that and the university. I would say OSF, St. Francis is a huge, level 1 trauma center, largest care center in the central Illinois region, and so receiving lots of transfers from smaller rural community hospitals.
I have been shocked. We're a smaller city, but we have a huge hospital system. We get to see just a multitude of different pathologies here. It seems like every week we're seeing something that could be written up in a case report.
So I think that the clinical pathology here is very robust, and we're able to kind of serve as a huge catchment area for downstate Illinois. I would say Peoria is a great blend of the best parts of life with a small town feel.
I think the size of the city itself is a huge perk. So it's big enough that we have amenities, things to do. We have a great park system, so I really like hiking, mountain biking, so I'm able to do those things here.
I kind of like it because it has a little bit of texture to it. There's kind of wooded hills in the area, which lends to a little bit more of a natural things to do in nature.
I think that you really are able to kind of have big city living without all those drawbacks of living in a million plus city like Chicago.